When we look at ovulation, primary ovulation disorders, or you talk about ovarian insufficiencies, nearly 20 to 25% of women do experience situations where their eggs are actually not growing. That means their follicles are not developing. Okay, they have eggs, the ovaries have eggs, but it's just that every month you would expect a lady to have the egg or the follicle to grow right up to mid-cycle, and by mid-cycle she's supposed to ovulate. Then she's considered fertile. But it doesn't happen, all the time. Okay, there are situations where some women experience it only sometime. Okay, have certain cycles in a year. Some do not even have ovulation at all. Okay, so this is where we need to assist them. Okay, so when we do see them, we assess them, we scan them on the 10th day, we see whether the eggs are growing or not. If the eggs are not growing, then we do have fertility medication. So we could give either fertility tablets or injections to help these women to increase the to make sure, to make sure that the follicles are growing. And by assessing them again on the day 10 or day 11 of their cycle, we know that the eggs have achieved the size that we want. So this is a relatively common problem. There are also situations where women actually have less eggs than they are supposed to. That means the egg reserve actually drops faster than it should. These are not very common. Obviously, when that happens, we need to investigate further and see what are the causes. Alright, but these are difficult situations to manage. It can be lifestyle issues, especially for women who smoke heavily. Smoking has been shown to reduce the number of egg reserve. One, obviously, if the patient has been taking certain illicit drugs and all that, it could have an effect. If the lady has unfortunately had cancer and she had undergone treatment for cancer itself with using chemotherapy drugs, which can also affect the egg reserves. If the patient had gone for radiotherapy, again in a situation of a cancer, it could also affect the egg quality and the egg reserves. So these are all issues that we need to look at. Sometimes it could be genetic, sometimes it could be certain diseases, we call it connective tissue diseases, which can actually have an effect on the egg reserve as well. So if I do see a lady and then I examine, obviously as a fertility specialist, I have to investigate thoroughly.